What's that in my shirt? What's up, y'all? How y'all doing today? I'm doing better. I want to thank everybody that reached out to me, called me, showed me love. I needed it. I needed it. Anyway, y'all, I'm getting ready to go to my primary care 2-month visit. She tried to keep a close eye on me because a lot of the medications that I take, you know, they increase the risk of stroke, heart attack, diabetes, and other comorbidities. But today, the reason why I'm going there is to get a GLP-1. I'm kind of deconditioned and I haven't really been moving as much, and I want to try to get some weight loss. And let's do it, y'all. Let's go. Let's go. My mama and King Hank. I haven't vlogged in a couple days. I just been resting. I didn't feel well yesterday. I don't know what it was. If it was that Lupron injection that made me feel bad, but I was having a lot of bone pain and I just rested. You gotta listen to your body sometimes. Anyway, my Uber is it's 4 minutes away. Yeah. So let's go. Let me try this on. Lip gloss. Then put makeup on and just did a bare face today because I'm trying to get used to wearing a mask when I'm going into these hospital systems and doctor's appointments because my immune system is not low. My white blood cell count last time I checked was like 3.9, which is on the low end. But hopefully since I stopped chemo, it kind of increased a little bit. So scarf because it's cold outside.
My son actually seen some of the text messages.
Hydration. Okay. I think. Oh, I think. Yeah. Did he take a big bite?
And normally with the king cake, they put a baby in it. And so when you play, whoever finds the baby have to buy the next king cake. It's a
like
cream cheese,
Cinnamon, nutmeg, the spicy.
Alright. How you doing, Dr. Aguilar?
Good.
That's good. How your new year?
It was good. My husband suddenly decided one day before, let's go to Miami.
Miami, oh wow.
But Miami was cold. It was 30.
Oh yeah. This time of the year, it can get cold.
It can, but then every day it was increasing by 5 degrees. By the time we left, it was really nice. I was like, what is that?
You have family in Miami?
No.
Oh, y'all just went on vacay.
Yeah.
I'm your last appointment for today.
Mm-hmm.
Good.
So you want to take GLP-1?
Yeah, I talked to my surgeon, the medical oncologist and the surgical oncologist, and the surgical oncologist thought it would be a good idea because she said she want to have my BMI down before I'm have to have another surgery on my reconstruction because I had a double mastectomy. And they're gonna take my stomach fat and make me some breasts. That's called a flap. So.
Oh.
Yeah,
So you're a double mastectomy.
Mm-hmm.
Did you have cancer in both, or you just decided?
The left.
But you got that one also.
Yeah. So I've been kind of deconditioned. Like I really haven't been moving as much after chemo and surgery and stuff, and I gained a significant amount of weight. So, and with the steroids and stuff, my sugar was kind of like borderline and kind of high.
Right now, blood sugar is not bad,
Okay.
but I will double check. Because if you're not diabetic, which you are not,
Mm-hmm.
then Ozempic is not covered. The two things that can get covered is Wegovy and Zepbound.
Okay.
Okay, so let me just tell you the side effects. So, nausea, constipation, abdominal cramps. Some people get very tired on these medications, but these are the side effects. Okay? Not everybody gets tired, but as a patient, I have to tell you what are some patients experience.
Mm-hmm.
So now let's look at your medications. You take gabapentin,
Mm-hmm.
amla cream. That's
Yeah.
on your boobs.
I'm on my port. I got a chemo port.
Miralax.
Yeah. Just sometimes
Okay, sometimes. How about tizanidine?
at bedtime.
Huh?
Bedtime.
Bedtime?
Night. At night.
Night.
Mm-hmm.
Right.
I started that after surgery. Because they did a lymph dissection on my left arm. They took 12 lymph nodes. And I've been having some pain in that arm.
So where is the pain that you need to take tizanidine for?
It's more like nerve and muscular right here
Right.
and right here underneath in the axillary.
It's about like a chest pain.
Mm-hmm.
Any medications you need refills on?
No, ma'am.
So I will write you Wegovy, see if it gets covered.
Okay.
It's once a week injection. So generally I tell patients to take it on a Sunday or a Saturday.
Mm-hmm.
Then you don't forget.
Okay.
So automatically it goes for prior auth. Okay?
Okay.
And my nurse will let you know 1 hour the prior auth gets covered. And you want to do blood test for.
Do you think I need the blood test?
You tell me what are you looking for, and then I'll tell you yes, no.
I'm really not looking. I'm just making sure I'm not diabetic. But you said you reviewed my sugars. They was like okay.
It didn't look, but I will do that. Okay.
Okay.
Okay. So I've told her the side effects, and we give 1 injection a week. The pen is good for a month. It has 4. You will understand when you get it.
I've given it to patients before as a nurse, so.
So you know.
Mm-hmm.
I forgot to write refill on it. Okay, so I have given you some Vigovi, and I have, we will measure your weight. You can measure your weight yourself to your nurse once a week.
Okay.
First thing in the morning after a bowel movement. Because here you wear clothes, shoes, it's never accurate.
Mhm.
Okay? So that's what you will have to do.
Do you think that the A1C will give a false interpretation? Because like the last 3 months I've been on so many steroids.
So A1C tells you blood sugar of the last 3 months. If you have been on blood steroids or blood sugar is high, then A1C will be high.
Yeah.
It's not false. It doesn't make false reading.
Well, yeah, not false.
It's just gonna make it high.
It's gonna make it high. But now I'm not going forward. I'm not gonna be on any steroids.
Okay,
So I
so-
should be better.
So do it now, and then I will have you come back and see me in 6 weeks.
Okay.
We'll recheck then. Do you want to come here, or you want to do is on phone video visit?
We can do a phone visit. Do you get paid the same amount of money for telehealth?
Paid?
Like, do
I
you
don't
get
know.
the same amount of money for telehealth versus inpatient?
I wouldn't know. They don't tell us. I don't even know how much each visit we get paid.
Oh,
Nope, I just see patients.
oh, you a good one.
Right.
I don't know. And I don't want to know.
Good morning. I just got off the phone with my social worker from Dana-Farber. I thought it would be a good idea to reach out to her and see what resources that were available to me. I had a couple questions about like what resources do people really don't hear about or think about that are available to cancer patients. And she was telling me that they had like an online program where they offer some type of yoga training and like cardiovascular health, weight management groups, survivorship for young women between the ages of 18 to 45, and I'm interested in that group. So I told her to send me resources about that. And then, you know, just trying to get back and forth to Dana-Farber Hospital is an hour. I don't drive. I don't like driving in Massachusetts, but I'm working on it because, you know, it's crazy out here. So I need to like work on it, but right now it's not the time. So I usually take a Uber or a friend to take me, or I take the train, which I don't like taking the train because flu season is heavy, COVID is heavy. So I just really want to talk to her about that. So she said she was gonna put me with my resource manager. Her name is Emma, to help me about, you know, getting back and forth. If I take a Uber to Boston, it usually run me about 120, 150 round trip. Sometimes I can find one. Like last week I found one for like $37. I was like, what? So, you know, I hit that button like, bam. But other than that, I really, really, really am so grateful for all the resources that I have at Dana-Farber. They don't hesitate. They call you immediately. She's gonna call me back next week. She did go into detail about like suicide. Have I ever tried
to harm myself. And I must be honest, I have. When I was 21, I really, really tried to harm myself. Like I took a bottle of Tylenol. I just wanted everything to be over with, and I had to have my stomach pumped at the hospital. And then after that, they was gonna commit me to the hospital for 3 days. And when I heard that the nurse left, I put my clothes on and I left out of the hospital on my own. So I didn't get no counseling. I just prayed about it. And God, He really brought me out of a hard time, and He lifted me up. And when people say God won't do it, He will do it. You just got to listen to Him, be patient, and do the work. I'm telling you, He will bring you out of places that you never thought you could come out of. The darkness will turn into light. And me and her discussed that. I really don't tell people that, but we all have darks and these things that we don't want to talk about. But when we talk about that, it really helps you heal. And you can heal when you can tell somebody your story and you have strength. You come from a place deep within, and you just bring this amazing strength to the forefront, and people see your strength, and it really like elevates and motivates other people. And I'm so glad that God had that one part of me that I was able to heal from. And yeah, I'm doing better. I wouldn't think about harming myself now at the age of 40, but when you in your 20s, things are crazy. You think you in love, and he doing whatever, and you doing whatever, and y'all doing whatever together. It's so weird. Like, I won't want to be in my 20s again. Like, if I did, and if I could go back, honey, I wouldn't date my baby daddy at all. Like, I wouldn't. And the other man after that, I wouldn't either. Anyway, so me and her name was, what was her name? Erin. Her name was Erin. I got too many people, Emily, Erin, with these E names, but Erin, she my social worker. She went over a lot of questions with me. I did ask her about transportation, and I asked her about any group therapy. She also is gonna refer me to a psychiatrist because I've been having a lot of symptoms with menopause. Like I've been having hot flashes, I've been having dry skin, I've been having insomnia, I've been having anxiety. And I think the anxiety is coming from the place where I can't sleep. And along with the not sleeping, I'm up and I'm feeling sad because I can't sleep. Sleep is a factor in a lot of hormone making, and just making you feel good. And we just gonna put it as simple as that. Sleep make you feel good. If you're not sleeping, you feel horrible. Like you can't even think, concentrate, you grouchy, blah blah blah, and the list goes on. So she gonna refer me to a psychiatrist, and hopefully the psychiatrist can help me. She was asking me, have I thought about taking anything for sleep? And yes, I have. I have done all the sleep habits that I posted about for y'all, like making sure the lights turned off, making sure I get in the bed, making sure it's cool, make the room temperature is cool, making sure everything is, nice, and I got a good pattern of not being on the phone 30 minutes before I sleep. Just all of that. If I wake up, making sure I don't turn the lights on, and making sure that I'm in a calm environment, and it's not working. It's just not working. Melatonin, tea, chamomile tea. I tried that. I was looking for Benadryl the other day. I didn't have Benadryl, so I wasn't able to take that. But I don't want to be like taking Benadryl at night. I'm already dehydrated, and Benadryl is an antihistamine. It dries up everything. I don't want to be like extra dry. No. But anyway, I'll take y'all through that journey and let y'all know what the psychiatrists say and how they handling that. But other than that, I'm doing good. Um, we supposed to be getting some snow this weekend. We always get snow. Like it's not nothing different. We have to just stay ready for that. And yeah, I got about a week and a half before I go back to work, and I'm excited. I'm so excited. And that's one of the reasons why I'm trying to get my sleep pattern, back stable, because like I want to be sleeping and waking up at 5:45 in the morning rested. I don't want to be up all night and then when 5 o'clock come, I'm still tired. That's not no good for me or my team at the hospital. So I'm trying to do everything I can to be proactive about my health and making sure that I take care of everything I need to take care of for me. And on that note, I need to call the insurance company and see about my medication and if it has been approved or not. So let me handle that and I'll call y'all back. Hey. You ever been going through your phone and you deleting people numbers or like you blocked them a long time ago and you still had their number for some reason, but you finally delete their number? You like, this is real. Like, I know I'm not gonna be talking to them no more. Blocked, deleted. It's final. Kicked out. Kicked out.
I know I said I wasn't going to be like looking for a second job. And the second job that I had before my diagnosis was agency nursing job. You know, I've been a nurse 20 years. This is my 20th year. I think last year was my 20th. This is my 21st year. September the 7th of this year will be my 21st year as a nurse. But you know, it's just so comforting. Like you already know like what to do. Like I could be walking any facility. I don't care if it's in Washington State. I don't care if it's in Alaska. I don't care if it's in Hawaii. I don't care if it's in Antarctica. I could literally walk in any state and do my thizzle. You feel me? But going forward, nursing is very hard. You're standing on your feet all day. So I'm not gonna renew my nursing license, and if I do renew them, I'm not gonna work as a nurse. I'm looking for some provider jobs, preferably urgent care. And I do have an interview today at 12:30, I think, for one of the places in my local area. Yeah, I think it'll be better. It's less work, just sitting at this, and the hourly rate like $100 an hour. It's per diem. I can pick up as I need. I don't have to really be worried about like, oh, I have to work these days. I think it's flexible and I can make my own schedule and I can pick up like 2 days. I'm only required to work 3 days at the hospital, but going back to work in the beginning, I'm only gonna be working 2 days, and that gives my body time to like, you know, renormalize and get back with the program. And I can pick up one day a month with this per diem job, one day a week, whatever I feel like is comfortable for me. So yeah, I'll let y'all know what's up with that. We got a lot of journeys we going on. Weight loss journey, new job journey, going back to work journey. I didn't tell y'all about school journey. That's a whole other issue. We'll talk about that later. And just getting back to normal journey, the new normal, the new normal, okay? And living life, traveling. I can't wait to go on my first travel. And yeah, I'm looking forward to it. All right, y'all. I gotta get up. I want to take a walk while it's looking a little normal outside. So let's do it. All right. Today's my first day outside taking a walk. I'm by myself. I feel good. I feel like walking every day until I go back to work is going to help. I have a whole plan in place. Um, I'm going to walk a block the first couple days and then I extend my range therefore after. So get these knees and stuff moving. Gotta walk. Gotta get some exercise. Let me show y'all the ground. It's a little icy, not too icy. But you gotta be careful. This ice, you'll slip and fall. Okay. Okay, I have walked about half a mile and I'm tired. But I did it. And I need to do it one more time before the day out. So I'm proud of myself. Whew, gotta get back to it. And it's time. Yes. Skin. Hey, I hope y'all doing good today. I'm doing great. I just had a walk outside for the first time. It felt great. I felt like a new person. I was enjoying the air and enjoying the breeze, even though it was cold. I don't know the exact temperature. I think it was like 20, but me, I love cold weather. My body just like it. Sometimes my knees do kind of hurt, but with exercise, it does help a lot. Yeah, so I'm just sitting here waiting on my interviewer to call me. She was supposed to call at 1 o'clock. It's 1:04. So I'm just sitting here. I have kind of prepped myself. Oh, here she is. Here she is. Here she is. Hello? Yeah. Hey, Holly.
Hi, how are you?
I'm doing great. Thank you. How you doing?
I'm so sorry. I think I'm a few minutes late. My call ran over. I apologize.
Oh, that's okay. That's okay.
So how are things going? You're interested in working with us in Worcester?
I am. I'm so interested. I have driven by the place a couple times and I said I should apply. And I saw it on Indeed. So I applied quickly.
I'm so excited about it. Thank you.
No worries.
Are you still with the University of Massachusetts?
Yes, ma'am. I work there full time, but I only work 3 days a week.
Got you. And so is your plan to stay there and then work with us around that?
Yes, I'm so excited. I've been looking for a per diem urgent care job, and I said I would like to do it, like 2 days a week or so if I have that availability to work with a place that will work with me.
Awesome. So per diem, that's great. With per diem, you can work 3 12-hour shifts in a month or more. But with per diem, you can decide what you want to work, what you don't want to work. You can accept and decline.
Okay, yeah, that's good.
And then you can decide what you want. That's awesome.
Okay, thank you.
So, yes. So you've had your license since 2024. Would that be right?
Yes, that's correct.
Good for you.
Thank you.
And in your current role, it looks like you do lots of different things. Do you think you would have experience in things like suturing, splinting, I&D, and wound care?
Yes, ma'am, I do. At the current position I'm in right now, I do a lot of suturing. I probably suture a lot during one day. And
Wow.
yes, ma'am, these include simple uninterrupted I&D. I'm pretty familiar with that. Do a lot of wound care in the position I'm with now because it's a surgical position. I also consult with the wound care team, which I have learned a lot from. Not only that being in my position now, but my current role, my past role as a nurse too. So yeah, and also splinting too. I can splint. I'm pretty proficient in that.
Great. I'm sorry you cut out. What can you do? I'm sorry?
Splinting?
Oh, good. Splinting. I wanted to make sure.
Yes, ma'am.
Awesome.
Mm-hmm.
How do you feel about laceration?
Lacerations, like far as like a suture in a laceration.
Yeah, you feel good about that?
Oh yes, ma'am. I feel very confident in that. I suture a lot of lacerations on the job, my man. I'm in the neurosurgery. We have a lot of people that come in, wound. They have like car crashes, or motorcycle vehicle accidents. So I do help with that, especially in the trauma department. We do a lot of that. Mm-hmm.
Great. How about patient volume? How many patients do you think you would see, like 80 or 82?
Okay. I probably
Is
could.
that doable?
Yeah, I could do that. Yeah.
Okay. We do have an RVU plan,
Mm-hmm.
which compensates you. It sounds awful, but it's the business. It compensates you per patient you see after a minimum level of patients. So you would see upwards of 45 patients a day,
Mm-hmm.
right? And some of those might not be very acute and won't take any time, and some of them will take longer.
Mm-hmm.
So you're also compensated on the acuity level as well.
Okay. That's a good
which
incentive.
is wonderful.
Mm-hmm.
We also have a couple tools to help you, one being Dragon Dictaphone,
Mm-hmm.
and our EMR system is Xperity. Have you used that before?
No, I haven't. I haven't used that one. I've used others, but they're pretty much all the same, a little bit different.
They are.
Mm-hmm.
I 100% agree with you, for sure. Talk to me about your questions. And ping a chat message, and I'll get responses right away from your team that are out in the field.
Okay, that's good. We have that at the hospital also. Yeah, I like that. Mm-hmm.
Yeah, it is. Great.
And then I have another question. What is the onboarding process for the per diem providers?
Yes.
Mm-hmm.
Yep, great question. You'd actually work with our lead provider and shadow with them,
Mm-hmm.
and make sure that you're feeling good about your patient load and where things are. And you would do that until you and the lead provider are both happy.
Okay. That sounds good.
And pretty quickly in a 12-hour shift.
Mm-hmm.
And that goes up on acuity level.
Okay. All right. So that's good.
Fantastic. I'm going to send him an email with your resume and all the goodies we talked about, what hours you want to work, that you have the clinical skill set.
Mm-hmm.
And then he'll tell me whether he'd like to speak with you.
Okay.
He's really quick.
Whey protein. Pure protein.
Uh-huh. That's where she got it from. Put some butter in here. Let me put my sausage. Sausage.
Brown sugar.
I need to get some powdered sugar. Some brown sugar baby, get high, feel love intoxicated. Ooh, a brown sugar baby. Man, what else? Oh,
Hello. Cinnamon, butter, everything.
hey. Oh, spicy, yeah. Ooh, that look good, bro.
Just a little something mini.
A little something
A
fun,
little
yeah.
snack.
A little snack attack. Ooh. Some cinnamon in that joint. What else? Just had my interview. She said she loved everything I said. I prepped, I studied, and I delivered. I think I crushed it. So going forward, I will be always doing it. And she said if the manager at the site like me, they will be letting me know if I could talk to him, and if he like me, then I'll go in for a shadow. Everything T, right? Just be doing anything. I'm trying my best. Wait. Come on, get high. Yeah, so I hope I get that job. It's right, like a mile or two from me. It's not far, so we'll wait and see what they have to say. The starting pay isn't what I want. I was trying to get 100, but she said it's 82 an hour. I take it. And then they have incentive. If you see more than 20 patients, you get $20 off top for every patient. And think after that, you will get like, it go up. But I like the incentive. And I'm just gonna wait. Y'all, fingers crossed. Make this oatmeal. I just plugged this up and it's getting hotter than my kettle on the stove. Like, for real. This one not even screaming yet. Oh, it's so dirty. Look at it.